The sheet's absolutely covered in blood.
Chainsaw injury to his head.
We need to get on and stop the bleeding now.
We're going to staple your head back together.
Shivering, shock shivering.
That's something that can cause someone to die within minutes.
I'm buggered.
I know.
Would you rescue me when I'm by myself? When I need your love, if I need your help, would you rescue me? Would you rescue me? But
There is a possibility he might die.
These days, it's all about how good their voice is and the singing stuff. Whereas it used to be more poppy. Dancey, poppy, sort of crazy, funky Euro stuff.
Rather than artistically.
Now it's more, I don't like that.
At the Royal Melbourne's Emergency Department, Doctors Sarah Whitelaw and Jonathan Papson are taking a rare break between cases.
Well, yeah, that doesn't sound like he should have won the popular vote.
He was the favourite.
I think that we enjoy working in a team. We enjoy the contact and the conversation with the colleagues that we have to have so many conversations and different type of relationships with throughout the day.
Up above them, on the hospital rooftop, an air ambulance is landing with a badly injured patient from country Victoria.
A trauma alert has been put out.
The emergency team swing into action, preparing for the worst.
I just going to get you some long bandages.
Even though Dr. Sarah has almost 20 years of trauma experience, she still gets anxious when a new case arrives.
I think we enjoy really bringing order to chaos. So it's that knowledge and that adrenaline that you get, and it sometimes can be a real fear. I still have butterflies going to work.
A gentleman has had a chainsaw injury to his head. The laceration is about 25 centimetres long. We want to make sure that we're set up to manage all the complications of a chainsaw injury, which might not just be an isolated head injury.
61-year-old Mark was using a chainsaw to trim branches on his rural property when the accident happened.
Initially, I'm worried about, is he actively bleeding an enormous amount of blood? And then I'm really worried about a brain injury.
A chainsaw through the head.
Nurse Lucy Stranger has arrived at work just in time to help Dr. Sarah and the team.
And you're getting some bloods.
Mark is conscious and in shock.
That's shivering, just shock shivering.
This is Mark, 61, was operating a chainsaw, was unseen, believed to have picked up and struck him right on the top of the head from the hairline back 25 centimetres and opened up about a 3 centimetre gash. He was found by his friends in an altered conscious state. They stemmed the wound. They didn't describe it as spurting, but heavily seeping. The only strange thing is he's very hard of hearing. He says that's new.
How are you feeling?
Sore.
Yeah, where are you sore?
Middle of my back, top of my head, back of my neck.
What we don't want to do in a case like Mark's is get distracted by the fact that he's got a very big cut on his head. If it's not actively bleeding and he's not literally bleeding to death on the floor, then we're probably going to ignore that until we've made sure that other things are stabilised.
Dr. Sarah's priority is an ultrasound to see if Mark has any life-threatening internal injuries.
I know you probably can't hear me. Yeah.
Sorry.
I said I'm going to do a scan of your tummy just to make sure there's no injury to the tummy because it sounds a bit unclear exactly what's gone on. Deep breath in. Good man, good man.
If we find evidence of a ruptured lung or bleeding around the heart or bleeding into the abdomen, and if we don't address that, then that's something that can cause someone to die within minutes.
Raoul, what are you doing? You right?
Yeah, trying to get...
Dr. Fiona Nicholson has spent her entire career at the Royal Melbourne, treating whoever comes through the emergency doors next.
I've been at the Royal Melbourne for 26 years as one of the, I just have to say, senior doctors in the emergency department. Makes me just feel old, but yes, it's still something that I enjoy doing.
So I think you're actually fine, but if it was a stroke, that would be a bad idea that you didn't turn up yesterday. And if you thought you were having a heart attack, it was an even dumber idea, OK?
While Fiona has a no-nonsense approach to her patients, the job can still get under her skin.
I know everybody always thinks, oh, you know, I could get hit by a bus tomorrow, but it would never happen to me. I see the person who got hit by a bus. I do think it can happen to me. You know, things can change at a minute's notice.
In Resus 5, Dr. Fiona is responding to the emergency buzzer for a young man whose heart is racing out of control. She must act quickly to save his life.
What's your name, darling? Say that again.
Raoul.
Raoul, is it? His heart rate is running at about 200 and second glance suggests that his blood pressure is about 80, both of which are really abnormal. What happened today?
I was stressed out fighting with my girlfriend.
Okay. Has this happened to you before?
6 months ago.
Do you take any regular medication?
I stopped taking it.
Now, what were you taking, do you know?
I can't remember.
I'm just trying to get a blood pressure first, and then I'll get that second line.
35-year-old builder Rail's heart rate is more than double a normal resting rhythm.
When your heart's racing at 200 beats a minute, the heart barely has time to fill with blood before it's pumping again. So his blood pressure's really low, which has the effect of making him feel like he's about to faint constantly. How long have you been in this rhythm? How long ago did it start today? Sorry, Dale. When did it start today, Raoul?
About 9 o'clock this morning.
The heart is a muscle. It's running a marathon in there. It's already been fast for about 3 hours now. Occasionally people's heart does stop because it just gets tired. So if we don't do something, something will go wrong for Raoul because your heart just can't keep beating that fast for that long.
Dr. Fiona's preparing to use a powerful drug, which Rail's been given before. It's a drastic solution, and he's dreading it.
So we use adenosine, which in theory stops your heart, the transmission from the top part of your heart to the bottom part of your heart for 3 seconds, makes you feel like you're going to die. Yeah, okay. And then your heart starts again, okay?
Do I have to be conscious?
You do have to be conscious because otherwise I don't know if it's working or not. Okay? Sorry, Dom.
Sorry, that thing's friggin'
Yeah, no.
You never do anything.
If the drug fails to stop Rail's racing heart and reset its rhythm, the only option is an electric shock.
Will someone grab that ECG, please? I'm going to shift these pads on your chest so should anything happen, we can shock your heart. So let's just reposition all of this and get them in the right spot.
You have a really fine and comforting voice. Thank you.
I'm going to hold this while we...
My pleasure, darling. Sorry, more free waxing coming up. I'll be as quick as I can. That's it. Going to sit you up for a minute, sweetheart. Just for a sec while I put this on your back, okay? That's it. Back you come. Well done. What we're going to do is a dose of the adenosine.
If it works, the drug will stop Rail's heart for several seconds, and he'll feel like he's dying.
So you're cool, Raoul. You know what's going to happen, okay? His heart will eventually tire, and the consequences of that is that it can just stop, and if your heart stops, then that's fatal.
Oh, God damn. You found that damn thing yet?
I'm going to roll you to your left-hand side.
In Trauma Room 1, Nurse Lucy Stranger is caring for chainsaw victim Mark, who's suffered a massive gash across the top of his head.
The doctor is going to poke down your back. Say whether it hurts or not.
No. No. No.
You're all done, Sarah? Yep.
Nurse Lucy and Dr. Sarah Whitelaw examine Mark's whole body, and the only injury so far appears to be his deep head wound.
We're looking for things like, is the skull fractured? Are we able to see brain on view? Does this person need to go to the operating theatre straight away to relieve bleeding that's causing pressure on the brain?
So we're just going to take the bandage off and have a look at what's under the bandage.
The dressing put on by paramedics has to be removed carefully.
We do know that that bandage might be solving a lot of the problem of keeping the wound together, and when we remove it, that suddenly a whole lot more bleeding could happen. How long does it, how far does it extend down the back?
All the way down to here.
Okay. You can irrigate it a bit, but I wouldn't get in there with a syringe and really irrigate it. We can do that when we get back from scans. You're doing well. We're just putting the dressing back on. That big Mr. Bump dressing that you had on was great. We'll do another one of those.
It's a temporary fix before surgery.
I've got that neck, so you're right to fiddle a bit.
You're doing amazing. Penny, do you know what he was doing today?
Mark's wife Penny has arrived and is making sure she's prepared for Mark's confronting head wound.
What he was doing with a chainsaw, I have no idea. Anyone's guess. We don't want him to move his head because we're just trying to protect his neck. Now his hands look gruesome. There's blood everywhere. Your head seems to do that. I know. Yeah, exactly. It's all right. Brilliant.
With a chainsaw.
No, other instruments. He looks messy. He's got a massive cut through his head. And if I saw that on somebody I loved, I'd be horrified. It can be really, really terrifying. Yeah, if you haven't been forewarned, that one moment can be quite haunting. Mark? Hello, darling. How are you?
Can't hear you.
Okay, that's fine.
Sorry.
I'll bring it down, Kenny, just so you can get into him.
Hearing is bad.
I know. I know.
Mark isn't good, and Lucy needs to get to him quickly.
You right, Pen? It's okay. Burping. Mark?
Hi.
Do you feel sick?
Yeah.
Yep, all right.
Nurse Lucy needs to roll Mark on his side to stop him from choking on vomit, which could kill him.
Do you want to come and tape up the back of this head? Well, don't touch the bandage if we can help it, but if you want to do a supporting bandage, it's great.
Mark's terrible wound is bleeding a lot, and it'll need closing in the operating theatre.
We're still unsure as to whether Mark's got a brain injury underneath that big cut. So it's important that he goes to the CT scanner first and see whether or not he's got a brain injury, particularly an ongoing bleed in the brain that's going to get worse. That's the thing that is a bit unknown at this stage.
Down the hallway in Resus 5, Rail's racing heart has been speeding at more than twice the normal rate for hours, and it's under enormous pressure.
Rail, we're going to go with the adenosine. You know what's going to happen?
Dr. Fiona Nicholson hopes to stop Rail's heart dead in its tracks for a few seconds by injecting him with a fast-acting drug.
The adenosine helps short-circuit the wiring system in his heart and potentially allow the heart to go back into its normal rhythm all of its own accord. It does make you feel like you're about to die. Okay?
Everyone's looking for a heart rate below 80.
So, nothing there, Rail? No. What do you want to do? Do you want to go 12 or do you want to go electricity?
I think his blood pressure's now 60, so
The drug isn't working, and Rail's blood pressure is plummeting. Dr. Fiona is forced to take extreme action.
Adenosine didn't touch anything. It obviously wasn't enough to get to you, or you're a bit too stimulated. So I'm going to make you asleep. I'm going to give you a shock while you're asleep. Okay?
Rail's given a sedative while the electrical charge is prepared.
Charge to 200?
Sync, charge to 2.
What?
Am I supposed to be out yet?
No, I'm not going to do anything till you're asleep. It's all right. I'll check in with you. Oh, I scared the crap out of you.
Don't talk about the bloody defib going down, right?
You'll know if you get defibbed. I think that knowing that you're about to get a current or a shock through your heart, that must be incredibly confronting and terrifying. Rail? Rail?
Before they can jolt Rail's heart to try and fix its rhythm,
Just going to take your oxygen off, darling.
Dr. Fiona must ensure he's completely unconscious for the risky procedure.
Rail?
Yeah.
Okay, you can go.
Oxygen's away. We're going to charge at 200. Right, we're at 200. Everyone clear.
It's late afternoon at the Royal Melbourne Hospital, and paramedics are rushing in a patient with potentially fatal head injuries.
This is Dean. He has had a full tonic-clonic seizure lasting a few minutes with multiple head strikes. Only medical history of epilepsy.
This sucks.
29-year-old Dean was on a first date with Olivia at a beer and food festival when their budding romance was interrupted.
He just went off to the bathroom and I just heard a big, thud and then a yell, and he didn't respond, so went into the bathroom and he was on the floor having a seizure. Bit scary to watch.
Should I be worried? I'm going to lose you. I'm not hearing a no. That's concerning.
The emergency department is the last place Dean was hoping they'd end up.
So much for a steamy shower session.
Hello there.
Nurse Julia Hoyles ushers the first daters to the treatment bay.
What'd you do?
I had a seizure and smacked my head.
Have you had one of them before?
Yeah, I've had epilepsy for 10 years, but haven't had one for a while.
If someone's had a seizure, they can hit their head on the way down and they can do some damage to the brain or brain bleeds.
So Dean, because we've got that collar on, we're going to slide you across to the hospital.
So we need to give him a top-to-toe examination.
Ready, set, go. And back, ready, set, go.
Hey, Dean, we're just going to change the collar, so I'm just going to hold your neck.
Dean hit his head several times during his epileptic fit and needs a CT scan to check for brain or spinal injuries.
No, thank you, though. If she comes here, she's just going to be super worried.
Under difficult circumstances, love is beginning to blossom.
Waiting for the clearance to go get the scans done on the neck and the spine.
It's awful with the wait times sometimes and there's not much we can do about it. He was just trying to concentrate on not being in pain, and I'm sure he was trying to keep a brave face for his lovely lady as well.
You've just gone to CT. Check the neck.
All right, everyone, we'll roll on 3. 1, 2, 3. Back on 3. 1, 2, 3.
As Dean is rolled over, his neck pain is beginning to concern Nurse Julia.
Where's painful mainly?
That one just then was the neck.
All right, we'll try and be gentle, okay? On 3. 1, 2, 3. Very good. Okay? Sorry, mate. We're looking for any potential head injuries, any spinal injuries, as well as limb dislocations and fractures, brain bleeds, which is the worst case scenario.
Oxygen's away. We're going to charge at 200.
Over in the resuscitation unit, 35-year-old builder Rail is critical. His heart is still racing out of control and his blood pressure's plunged dangerously low. So Dr. Fiona Nicholson is about to deliver an electric shock to try and reset the heart's chaotic rhythm.
He's already quite compromised, so we're going to start with 200 joules and cross our fingers that one shock's enough.
Right, we're at 200. Everyone clear.
Press and hold. Once.
Press and hold.
Moaning. Braille.
Blood pressure cycling.
The shock treatment has worked. Rael's heart is now beating at a normal pace.
Hello, darling. We did shock you and you're good, okay? But everything is good. You're back in sinus rhythm and your blood pressure's good, okay?
So how many toilet roll holders?
How many toilet roll holders? Pass on the toilet roll holders. You got one shock, which got your heart back into normal rhythm, okay? I'm going to keep you here for a little while and make sure everything settles down, okay?
We often find as people wake up that they say some funny things half under the influence of anaesthetic. I get lots of marriage proposals at that point in time. Sadly, I wish that they would continue when they're not drug affected, but that's okay.
Yeah, we're 90 now.
Dr. Fiona's concerned that Rael's stopped taking his heart medication.
You do need to start accepting yourself so that the medication that your heart doctors give you, you continue to take. And then maybe we won't meet like this again. Okay?
Rael comes out of the anaesthetic well and full of admiration for the emergency team.
Fiona was amazing. Speak your doctor speak and then just translate quickly for the layman's lying here in the bed. Yeah, it was really appreciated.
Rael appears to have had a lucky escape, but in case his heart starts acting up again, he's being moved to the ward for observation, and heart specialists will decide if he needs surgery to fix his condition.
Drum up and receiving.
Another air ambulance is inbound, this time with a seriously injured car crash victim.
Thank you, hands to you are clear to land. Drum up and receive.
22-year-old trainee nurse Tale is being rushed by air ambulance to emergency. Tale dragged herself free from her smashed car despite being seriously injured. Passers-by then called for help.
How's your pain? Is it okay?
Dr. Michael Dunn takes charge of the trauma room as paramedics begin their handover.
Okay, this is Tale. Single car accident into a tree. Seatbelt worn, airbag deployed. Self-extricated and then fell to the ground when she realised she had some injuries to her left leg and pain to the left wrist. The ambulance crews bandaged and left the leg in the position found. It was very difficult to straighten it.
Excellent. Tale has come in after a major car accident, quite a high speed. While the knee is quite apparently injured and very deformed, we would mostly be concerned about fluid around the heart, collapsed lung, some bleeding around the liver or inside the abdominal cavity that we don't necessarily see externally.
Pull on my fingers. Very good. Do you know where you are at the moment?
Yeah.
Well, Melbourne.
Sorry, dear. If I press there, is that sore?
Yeah.
That's very sore, is it?
Yeah.
The knee abdominally, is it though?
Yeah. Like, it's to my knee, but it wasn't.
No, sorry, it's not hurt a little bit.
Just a hard X-ray board, sweetie. Sorry.
Dr. Michael's so worried about Tale's left knee, he orders an immediate X-ray.
Good. Breathe away.
Tale, is it? From Tale's X-ray, it looks like she's got multiple fractures of her kneecap itself, and it's also penetrated through the skin.
The news is not good. The damage is so severe, it could put Tale out of action for months.
What you do?
Nursing.
Oh, really?
I know, I've got interviews coming up.
Not the side you wanted to be on, is it?
Tale was due to do her final hospital placement in just 3 days' time. Her dream job is now in jeopardy.
They definitely be concerned from a nursing career perspective to be on our feet the whole time. Having a knee injury like that may lead to some long-term issues, particularly related to pain.
How far does it extend down the back?
All the way down here.
In Trauma Room 1, Dr. Sarah Whitelaw's still dealing with the huge gash on chainsaw victim Mark's head. The accident happened when he was trimming branches.
Ow. I know that's not super comfortable.
The gruesome wound looks horrendous, but it isn't her biggest concern.
In a big head laceration, once the bleeding is controlled, is there a significant brain injury underneath? And I'm also very aware that there might be a spinal injury associated, so making sure that we don't move that spine unnecessarily is really important.
61-year-old Mark is on his way for a CT scan. If his skull is fractured, there could be bleeding to the brain, all because of a freak accident.
All right, Mark, we're going to roll you like we did before. I want you to stay nice and still. We'll do all the work.
The CT doesn't show any signs of significant ongoing bleeding in the brain. What it does show is a neck fracture. So very pleased that we had protected that neck. It also shows that he has a rib fracture and he does have a punctured lung on one side.
Mark's list of serious injuries is growing, and his wife Penny's trying to reassure him.
I'm buggered.
I know. That you're still alive, so that's good.
You can go.
I'm not going.
Ugh.
It turns out Mark is a bit unlucky when it comes to heavy-duty tools.
He's put a pickaxe through his head before. They bounce, apparently.
The bandage covering Mark's head wound needs changing again. Penny doesn't want to look, but doesn't want to leave his side.
So no skull fracture or this.
He's losing a lot of blood from the head wound, and the bandages aren't enough to stem the flow.
We're going to staple your head back together.
Well, the sheet's absolutely covered in blood. So.
Yeah.
This time, the procedure's too distressing for Penny.
Keep your head really still, okay?
Stapling is an option that's very effective at closing the skin quickly and putting it under tight tension, which will put pressure on the blood vessels and stop the bleeding. We know that Mark has to go to the operating theatre. He's going to need that wound washed out and repaired in several layers, which will take a bit of time, but we don't have that time. We need to get on and stop the bleeding now.
Do you feel me touching the foot? Yeah. Good. Can you wiggle the toes at all? Just the toes, good.
Over in Trauma Room 2, Dr. Michael Dunn is assessing trainee nurse Tale's shattered knee. The 22-year-old crashed her car at high speed during her daily drive to her grandma's house.
She's got multiple fractures of her kneecap itself, and it's also penetrated through the skin as well. This will be one of the more dramatic fractures that we've seen.
You, with this hand, hold your bad one, and you pin it against your body, okay?
Even though it'll put great pressure on Tale's knee, Dr. Michael needs to roll her to check for other serious injuries.
The knee injury itself, it's very apparent and causing a lot of distress, but there might be something more serious going on. Might be a spinal injury, so we have to keep an overall picture.
1, 2, 3.
All right.
Doing well.
Can you came back here?
No.
Back here?
No.
And can you feel down below? Down here?
Yeah.
Okay.
Just taking his like a trip.
I was lucky that the first lady pulled up was a nurse.
Oh, really?
She's on her way to work.
This is all round, All right, we're ready?
Yeah.
3, 1, 2, 3.
Oh.
Yeah.
Is your hip sore?
No, my hip's sore.
Ruling out spinal injuries, Dr. Michael now focuses on Tale's broken leg as she reveals there was another passenger in her car.
Oh, my cat in the car.
Oh, the cat. How's the cat?
Run away.
Probably need a scarf.
Tale's lucky to be alive, but she's realising the accident could change her future forever. Her precious cat is missing, her nursing career is on the line, and it's uncertain when, or even if, she'll walk again.
I think Tale is fantastic. I think she's been managing very well. It's quite a traumatic accident to be in, with a lot of unknowns at this point in time, but she's been extremely calm and cooperative.
Dr. Michael's preparing to remove the bandage for the first time to see the extent of the damage to Tale's knee.
Okay. Ready? Sorry.
Your hands? Yeah. You got some of the cannula in here.
In emergency, Dr. Michael Dunn is removing trainee nurse Tale's knee bandage. Seeing the extent of her injuries will help the trauma team decide what to do next.
Okay. Ready?
Hold it there. Is that okay?
Tale's knee is badly fractured, with tiny bone pieces scattered throughout the wound. It's a huge mess that brings new dangers.
The main task we have to do with the knee is immobilise it and also to apply an antiseptic dressing. Unfortunately, we can't leave the knee in the position it's in, which is comfortable for her, because the bone fragments themselves sticking out are going to be a high infection risk.
All right, dear, I'm going to take control of your leg, okay? We'll move it nice and slowly.
So Dr. Michael must try to straighten Tale's knee without causing further damage.
Sorry. Hold it there. Is that okay? I got you.
But she's in too much pain and needs immediate help.
Now put your leg down for a second, and then we'll give you some more strong pain relief, okay?
Tale's given a sedative so Dr. Michael can begin the difficult job of cleaning her wound and trying again to straighten her leg.
Is she pretty out of it now? Yeah, okay. Not much contamination.
Okay. Now, we're just going to try and straighten this slightly, okay?
Yeah, go for it. Does it feel locked or?
No, it feels tight.
It's really swollen.
It's probably straight as we'll get it, I think.
They've succeeded in getting Tale's leg into the best position possible. It's now clear she'll need major surgery if she's to walk again.
We have multiple fragments that we're trying to piece back together. So we'll plaster the fracture to keep it in place, and that will prevent any further injuries, but also will help reduce the swelling and probably give her a better outcome after surgery as well.
Sorry, sweetie, we're just putting a cast on there. Just try and keep your legs straight. I know it's really sore. It'll feel better once we're holding it really still with this cast.
Tale's leg is now set in place to stop any damage before surgery.
So scan it next.
Dr. Michael and his team have done all they can for Tale. She's facing months of recovery and rehabilitation before she can walk again. As his patient leaves emergency to await surgery, Michael can call it a day.
I personally love being a doctor. I am from a family of architects, and I was geared up to do architecture until I watched a season of Scrubs the day before I had to make my decision, and then decided that medicine was the way forward. The rest of my family in Ireland have no clue about medicine whatsoever. My dad was a little bit gutted initially, but nice to have someone in the family that can help them when they're sick. And my brother has a little niece now, and I get phone calls probably once a month with questions of rashes and things like that. So I have some use in the family, so they're pretty happy now.
Dean had an epileptic seizure on his first date with Olivia, banging his head several times when he fell in the bathroom.
Hey Ben, it's Julia around in 17. Just with Dean, we've just come back from CT. He's still got some pain, it's quite significant in the lower back.
Scan results are yet to come through, but nurse Julia Hoyles is concerned about the pain in Dean's lower back.
left the base of my neck, all the way through my toes. Never felt anything like it. Still can't move my legs too much.
It's now been hours since Dean's admission, and Olivia still hasn't walked out on their first date.
Not nice seeing him in pain, but good.
To stay in emergency for hours with someone you've just met, I think he's done pretty well, and I hope that there is a date too for them.
Dean flew all the way from Sydney for his date with Olivia and seemed smitten, despite them loving rival Aussie rules footy teams.
Even when I move down here, I'm not going to stop supporting the Swans. Even though she goes for Carlton, I'm not switching.
So we're going to roll you onto your side and have a better look at your back and see if we can work out where this is all coming from, all right?
Dr. Ben Land has arrived to find out if Dean has sustained a spinal injury.
1, 2, 3. Sorry, Dean. Breathe, mate.
So sore here?
No.
Sore here?
No. Don't shake your head, mate. Just yes or no?
No.
Sore here?
Yeah.
Right here, is it?
Yeah.
Sore here?
Yes.
Working in emergency where we're constantly surrounded by stress, people in pain, we've got to empathise with each patient and not just have patients as a number and really treat them with the care that they deserve.
All right, there's no major bruising or anything, but it is quite sore there. Okay, happy to go back.
1, 2, 3. Sorry, Dean. All done, mate.
I think, given that this pain is still quite bad in your lower back, I was hoping we could avoid it, but I think we'll go back and do some more scans of your lower back, all right? And just make sure there's no damage done down there. All right?
Olivia's marathon first date in emergency isn't finished yet.
Hey, Dean, have you had morphine before, mate?
Yep.
All right, warm, funny feeling coming in 5. Sorry, mate. Deep breathing for me.
My legs are certainly relaxing. They're not shaking. I'm pretty sure, though, going on morphine rules out having a beer tonight.
Could have told you that about 5 hours ago.
With his pain under control, the Swans fans' thoughts turn to more important matters.
Can you please do me a favour?
Yeah.
Can you please look up when the Swans are playing?
I like that this is your priority right now. 7:25 tonight.
Sweet. Let's get out of here by 7 o'clock now.
Dean's being optimistic. He's still got to get the all clear from the scans. And then there's his date, Olivia.
So I don't think I'll be forgetting this one anytime soon. A first date?
The main question is, will there be a second?
Two days ago, chainsaw accident victim Mark was airlifted to the Royal Melbourne Hospital, hemorrhaging from a massive head injury. Dr. Sarah and her trauma team stemmed the blood flow by stapling his head together as a temporary measure before surgery.
I'm buggered.
I know. But you're still alive, so that's good. Morning, Mark.
The 61-year-old is now recovering after surgeons repaired his head wounds.
I was just cleaning up some dead trees and doing a bit of work to make sure the place was safe. It's safe for everybody except for me. There's a fracture in my neck, there's one in my back, I've got a couple of fractured ribs. So I've done it pretty badly.
The good news is Mark's hearing has returned after it was damaged by the blow. He's also remembered how the accident actually happened.
I was cutting down a dead tree, and then I turned around and put the chainsaw down, and the tree had swung and then hit me.
So it wasn't a chainsaw that fell on his head, it was the tree. And being a world-renowned ecologist, he knows exactly what type of tree it was.
It was a blue gum, Eucalyptus globulus. It's very common on the Victorian coast west of Melbourne.
Go do the stamp today.
Rail's racing heart was stopped and successfully reset by Dr. Fiona.
Clear.
3 days later, Rail is being released from hospital and he's taking doctors' advice to book in an operation to fix his heart's faulty wiring.
I'm now looking forward to getting home and getting back to work, and hopefully I won't give anyone dramas after that.
All right, the scan's all good here. I'm going to take this off and just get you to slowly turn your neck for me.
First Aid Dean was admitted to emergency after collapsing and hitting his head while out with Olivia.
Can you turn your head all the way towards me?
Further scans revealed he suffered no permanent damage to his head, neck or lower back. He was finally allowed to go home late in the evening.
Can you please look up when the Swans are playing?
He missed the Swans game, but he and Olivia not only had a second date, Dean's now made the move from Sydney to Melbourne, and they're officially an item.
Sorry.
5 weeks ago, Dr. Michael's car crash patient, trainee nurse Tale, was rushed to emergency with severe injuries.
This will be one of the more dramatic fractures that we've seen, with multiple bone fragments sticking out.
Tale then endured a 6-hour operation to fix her ruptured knee. Now, Tale's back on her feet and on the mend.
You're up and walking.
The best I can.
Tara and Treen, the passers-by who stopped to help Tale after the accident, have popped by to see how she's doing.
To be honest, you're doing amazing.
To see you up and walking is just, I wasn't expecting to be able to see her up and walking.
Thank God.
After shattering her knee, Tale thought her dream of becoming a nurse was over.
I ended up still completing all my interviews. I just continued with all my coursework in hospitals.
Oh, that's wonderful.